Hello everyone and Happy New Year po sa lahat. Good morning, good afternoon, good evening po sa lahat-lahat ng sumasali sa ating 83rd episode ng Stop COVID Deaths webinar series brought to you by the University of the Philippines. Maraming salamat po for being part of our credible online community and to all those na mga nagtatanong kung paano po sila sasali. Na-discover lang po kami ngayong araw na ito for the very first time. Welcome po at sana po masayahan po kayo at patuloy po na tumangkilik sa ating webinar series. In the past 4 weeks, the Omicron variant has swept the world with vertical spikes on almost every continent. Para po sa Pilipinas, nagkaroon po tayo ng mataas po talaga, steep and exponential increase in the number of positive cases. Meron din po tayong mga record-breaking na mga positivity rates and that has been a cause of concern para po sa ating lahat. May mga nagmo-monitor din po ng ating mga kaso, lalo na po yung mga naa-admit sa mga hospital na parami rin po ng parami, pati na rin po yung mga napupunta sa ICU at sa ating mga isolation facilities. Ang mga experts po, pinipredict po nila na patuloy po tayo makakita ng surge or spike in cases at least for the next 1 to 2 weeks at kailangan po talaga tayo maghanda para po sa mga pag-increase po ng mga kaso. So for all those who are looking for the latest science-based and evidence-based information from the most distinguished experts, then keep it right here. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you, lalo na po, ito po ang ating kauna-unahang webinar sa taong 2022. And I always look forward to Fridays, not just because I get to share ito pong platform na to sa inyo pong lahat, which are now numbering a little over 1,000 na po. No? So maraming salamat po. Alam ko po marami pa pong nanonood sa Facebook at sa YouTube. But more so because I get to share hosting duties with the beloved mentor, ang aking partner. Sana po okay po siya sa Hawaii, our adjunct research faculty at the National Telehealth Center and the Special Envoy of the President for Global Health Initiatives, Dr. Susie Pineda Mercado. Dr. Susie?
Hi Raymond! Hi Raymond! Good afternoon po sa inyong lahat. Saan man kayo naroon. I hope you're all doing well. Raymond, na-miss na kita. And I miss everyone. You know, kanina I was answering in the chat. Wala, ay rusty eh. Parang hindi pala nakalagay to everyone. Humabol na lang ako. Anyway, binabati ko kayong lahat. Nice to hear that many of you are happy to be back. We are certainly delighted to be with you. And I do hope that you are okay because, Raymond, I don't know your experience, but so many of my friends and family have gotten COVID over the past few weeks. For the most part, it's been mild. So for those of you who have family members or loved ones who have had COVID, or if you're in quarantine right now, we hope that you'll recover right away and that you're going to be okay. So Happy New Year to everyone.
Happy New Year.
It's a new year. There are many new things. And of course, it's for us here at Stop COVID Deaths. It's a journey of learning para matuto tayong lahat, di ba? Parang we're all learning, maraming pagbabago. And so, ito, akala nga natin, medyo relax na tayo when we were ending the year. Tapos, eto na yung Omicron. So anyway, I hope you stay with us. And I just want to welcome everyone back. I really miss you all. And yung mga comments nyo sa chat, we miss them. Sige. So Raymond, over to you.
Thank you, Dr. Susie. Before we start off po with really our introduction, we're very pleased and humbled and honored po to share with you that our Stop COVID Deaths, your Stop COVID Deaths webinar series has been selected po as one of the awardees of the 4th Gawad Pangulo Award for Excellence in Public Service. Thank you TVUP for playing with. So, medyo late na po siya over the holidays po kasi siya na-award. So, hindi po namin talaga siya na-feature during our pre-end of the year, one of our pre-end of the year webinars po. But really, this award is a testament to all of the support and all of the yung pagtangkilik po sa ating Stop COVID Deaths webinar series. Sa lahat-lahat po ng bumubuo, lalo na po ang ating audience, ang ating mga resource speakers all the way back sa April 2020. So medyo magto 2 years na po pala tayo sa ating Stop COVID Deaths webinar series. Lahat din po, all the men and women talaga pong working very hard behind the scenes. Maraming salamat po, at ito pong award na ito ay para sa inyo, at patuloy po kaming magiging masigasig sa pag-churn out ng quality content so that we will continue to grow our credible online community. Dr. Susie?
Oo nga, congratulations everyone, and thank you so much TVUP. This is Gawad Pangulo ng UP, no? This is an award.
Yes, from the University of
by
Philippines System, Dr. Susie,
University.
yes. Apo.
And it's for public service.
Yes po, excellence in public service po. Yes po, thank you.
Wow, wonderful. And so I think this award belongs to all of you. Kasi lahat kayo naglilingkod di ba? So sa atin, this is, I think,
Very true.
a shared recognition, and just like to thank everyone, particularly TVUP and all the young creative people behind the scenes, Raymond, who are working. You don't see them, but we're not able to put together this webinar without them. So thank you everyone. Maraming salamat po. Raymond, over to you.
Thank you, Dr. Susie. So, gaya po nung nasabi po natin, no, mayroon po tayong very important topic for today, and not just because, so in the past, in our most recent po na mga webinars, we have discussed the Delta, the Omicron. I'm sure you were able to watch ang ating webinar wherein Dr. Susie was mentioning about the epidemics and pandemics, and the like, and what the future holds for each and every one of us. Pero nga po, ito pong ating for the past few weeks, our steep rise in cases. Dati po medyo lang tayo, 300 to 500. Ngayon, bumalik po tayo sa September 2021 numbers, culminating to, I think the highest was yesterday. That was around 34,000 and nearly 50% positivity rate. Yun po, the possibility of this new variant, although we have touched on it in our previous webinar, we will be more in-depth po in our discussion today of the Omicron variant, and those breakthrough infections, lalo na po sa mga fully vaccinated. So for those who are watching us for the very first, to put our discussion into context po, the team prepares po what we call person on the street video, just to get a pulse kung ano po what the common folk are really thinking about or are worried, their concerns, and maybe even their questions po. And for this POTS or person on the street video, the question that we pose to our interviewees are as follows: meron ka bang mga kaibigan o kamag-anak na ang buong pamilya ay nagka-COVID? Ano ang naramdaman mo? Ano ang iyong reaksyon? Nabalitaan mo ang nangyari sa kanila? Ano sa tingin mo ang pwede mong gawin para makaiwas sa COVID-19? Take it away, TVUP.
Bilang isang ordinaryong mamamayan, para makaiwas sa COVID-19, palagi akong nagsusuot ng mask, lalo kung nasa labas at kasama yung maraming tao. Tapos, iniiwasan din yung mga spaces na kulob. So as much as possible yung mga areas na may maayos na ventilation, and as much as possible kung merong mga alfresco dining dun sa nakakain.
Personal hygiene, ganyan. Alcohol, maligo ka araw-araw, maghugas ng kamay yun. Tapos, of course, yung PPE, bahagi din naman ng trabaho namin yun. So sanay na kami na magsuot ng PPE everyday.
Tapos wag yung masyadong pag sumasakay sa mga public vehicles, yung dapat hindi punuan kung hanggat maaari, kung may budget naman, mag-private, na lang, tulad ng Grab, mag-taxi.
Kung makaranas ka ng symptoms, i-make sure mo na i-isolate mo na yung sarili mo, or magsuot ka na ng mask kapag sa bahay ka, kasi mabilis talaga siyang kumalat.
Meron akong kaibigan na nagkaroon ng COVID. Buong family nila hindi pa sila vaccinated. Thankfully naman, nakasurvive silang lahat. Medyo syempre naging anxious ako. Syempre nag-worry ako para sa sarili ko, para sa family ko. Paano kung yun yung nangyari sa amin, di ba? So, niready ko na din yung sarili ko. Of course, nag-ready ako financially, pero natakot ako para sa akin, para sa family ko.
Yes, actually, yung family ko, yung mama ko, mga kapatid ko, nagkaroon ng COVID last February. 2021. Ang natira na lang actually sa bahay is ako at yung isang kapatid ko.
Nung nalaman ko na positive yung asawa ko, siyempre nalungkot ako. Nandun yung takot, yung pag-aalala. Yung dalawang anak ko, hindi pa sila vaccinated kasi hindi pa sila pasok dun sa 12 to 17 years old na nung ongoing ngayon na vaccination para sa mga kabataan.
Talagang kakilala na nagpa-positive yung sa cases nila, as in buong household nila affected na nung COVID. Hindi kasi ako yung alert naging alert yung family ko lalo. So parang din ako na dapat maging conscious rin ako sa decision ko kung lalabas ba ako ng bahay or not. So wini-weigh ko muna kung sobrang importante ba ng paglabas ko.
Madami rin akong nababasa ng mga articles na sabi nga nila this is the beginning of the end of the pandemic. Pero let's not be complacent with that thought kasi hindi natin alam what will happen in the future kasi pwede pang mag-evolve ulit yung variant into something na magiging detrimental para sa ating lahat. Let's continue and still follow the guidelines kung ano man yung ibigay ng ating mga experts na mga nakakaalam and mas maging maingat pa rin tayo ngayon. Sana tayong maging complacent lalo na it's our life na nakasalalay. So,
Okay, thank you very much, TVUP. It's always good to hear it straight from the people what they're thinking. And I don't know, Raymond, I'm listening to them, naisip ko parang talagang pinaka-importante yung handa tayo sa pag-iisip natin na baka merong mangyari kaya nag-iingat tayo. I think, and I've seen some of the news na even if the alert level is not the highest, people are still avoiding going out and so on. I think this is what we need. We need people to know and to be prepared, and for you, our health workers, to be a very good source of information, particularly because things are changing so rapidly. So thank you, TVUP, for those insights we got. And salamat sa mga nag-participate sa interview. Natutuwa naman ako na merong mga okay lang sa kanilang mag-on-cam. Sige, Raymond, over to you.
Thank you, Dr. Susie, and thank you, TVUP, for preparing our Person on the Street video. So just to let everyone know, our webinar po, as always, is able to accommodate a maximum of 3,000 participants. So please join us in Zoom so you can fully experience this interactive program. If you're watching naman po sa YouTube or Facebook, and for those who are asking, we have put it on the chat po, the link to the Facebook, at least for the Facebook live streaming page, so that you'll be able to share it with your friends, with your family, your co-workers. But hopefully, you'll be able to entice them to join us in Zoom po for the full experience of the online community. There are also parallel discussions happening sa chat box, whether here po sa Zoom, sa YouTube, or sa Facebook. We'll be trying to monitor all so that everyone has a feel that they're part of this webinar also. We would also like to invite everyone to participate po sa ating fun quiz. So bumabalik po ulit ating fun quiz. We hold it dito po sa Zoom poll. Meron din po tayong Mentimeter para po makasali ang ating mga viewers sa Facebook at sa YouTube. So for those who are not in Zoom, please open your browser po to www.menti.com. Ang code po na gagamitin for today is you enter the code 98764520. That's 98764520. We will have two questions, and it's the same question for Zoom and for Mentimeter. And for all those who are asking, ating mga certificates po, kumpleto na po. For all 82 webinars, we have distributed all of them to all those who have watched at least 50% of the webinar duration. Ito po ang itsura ng inyo pong matatanggap na electronic certificate of attendance. If you have any questions, please let us know, and we'll be trying to review also our database po. Thank you, Dr. Susie.
Okay, thank you so much. Thank you so much, Raymond. And someone was suggesting na baka this year pwedeng audience mag-suggest ng topic. By all means, mag-suggest kayo. So kung meron kayong mga gustong topic, lagay nyo lang dyan sa chat box. And to the best of our ability, we will include we will take your topic up. Of course, we want to present what you're interested in. Okay, so we're moving now to our opening speaker. Are you introducing him, Raymond? Parang sa script ikaw eh.
Well, no, go ahead, Dr. Susie.
Okay, all right. Opening remarks, somebody you know very well. One of the persons who started Stop COVID Deaths and has recently, congratulations, been appointed as the chair of the Department of Emergency Medicine Services at the Philippine General Hospital. And of course, that role is like putting a fish in water, no? Para siyang isdang nasa tubig dun sa emergency medical services. Also national special advisor to the National Task Force, Dr. Ted Herbosa. Ted, welcome to the webinar.
Hi, Happy New Year, Susie and Raymond, and to everyone in Stop COVID Deaths. Congratulations on your well-deserved award for public service. This is already the third year that Stop COVID Deaths has been offering. We started in 2020, remember, Susie? I think April was the month we started. And since that time, the community has grown. The information, it's been a big megaphone for information on this pandemic. And I also look forward to listening to all the great speakers that you've been able to invite here. And of course, the response of the general public and the loyal following of our viewers out there. We really like to thank you, and we need your help to continue this. I think this isn't over. It's really a marathon. Last November 26, the government of South Africa declared a new variant. It was called the Omicron variant, B11529, I think. But in about 2 days, the World Health Organization declared it as a variant of concern. That's the fastest ever that a new variant was immediately declared as a variant of concern. I think it's the fourth one, no? Alpha, Beta, Delta, and this one. And the reason for that is that the Omicron variant had in the spike protein about 30 mutations. And you compare that to Delta, it only had 10 mutations. So this actually scared our public health officials to declare it as a public health concern, a variant of concern. And true enough, in the next few days, not weeks, days, you had about 6 countries in Africa having a surge, and then another 6 countries, a total of 12 in the European Union. After another few days, it was in 35 countries, and after a couple more days, it was in 75 countries. It's now raging in the United States of America, has about 1.1 million cases a day. They even breached the death rate of about over 1 million in a day. I think sometime in a few weeks back. Even the UK was suffering something like 150,000 cases a day. So it's really highly transmissible, that we know. But the other good thing is that it seems to be mild. Many of the people are not being hospitalized. People are staying in their homes, and they are recovering very quickly. Well, that depends also on the vaccination rates in these countries where this has actually blossomed. And because of that, we've had experts saying, and you heard it in the man on the street, and they've heard it, that this might be the signal of the beginning of the end. I do hope so. They're correct. But there are also other, if you have continued transmission, we know for a fact that further mutations can happen. So it might not be the end. As I speak, I'm listening to Cabsec Nograles, and he just declared alert level 3 for the whole city of NCR, but there are about like several regions, I think 10 regions also on alert level 3. So dati NCR lang in a few regions. Now there are a lot more regions in the Philippines with the alert level 3. So it's really showing the high transmissibility. I think if you ask me honestly, even if the Genome Center has not really identified that the dominant variant is Omicron, I think it is Omicron based on the behavior. And we have our speakers to actually describe that to us. Thank you, John Wong. Thank you to Franco, who's actually here from the United States, from UC Riverside. And of course, Anna Ong-Lim. John Wong and Anna Ong-Lim are, of course, our faithful technical advisory group of experts in the DOH that give us information regularly and directly from all of that. There are still many things we need to know. My message for you as a special advisor and coming from the Vaccine SAR, Secretary Carlito Galvez, our message to our Filipino people is that we have been able to vaccinate 58 million individuals with 2 doses about 4 million people with the booster doses. But what does that mean? We have about 58 million with at least one dose. But what does this mean? We still have about 62 million Filipinos who are either unvaccinated or partially vaccinated. And this is the subgroup where the Omicron can actually spread and propagate and give us difficulty and stress our health system. So the message of the National Task Force is to get the unvaccinated vaccinated. So we're really hoping there is no problem in supply. We have over 90 million doses in our stockpile. We had about 64 million that was delivered last month, 64 million doses. And we have ordered the 15 million doses of the Pfizer Pediatric, which is supposed to be delivered by the end of January, allowing us to start the vaccination of 5 to 11 years old by February 1. So these are good things on the horizon. We do hope you can convince everyone. There are long queues now. The complaint now to the National Vaccine Operations Center, because of the Omicron fear, there are more people in the vaccine sites, but there are less people vaccinating because they're also getting infected and quarantined. More recently, there are many policies that the government has done, and we do hope that from after this talk, we will learn what we as individuals will do. But the government policies, as you can see, we have decreased quarantine rules for healthcare workers. And it's a great boon to us, especially at the Philippine General Hospital, where we have over 900 healthcare workers infected of the over 2,000 plus. And with just this change in the policy of quarantine, we were able to release about over 90 healthcare workers back to the front lines to be able to continue to work and serve our COVID patients. The other one is the news in the town hall meeting the other day. You heard the town hall meeting with Edsel, Anna Ong-Lim, and the other expert. I forgot the president of the PISMID, and they mentioned about the shift of the government from blanket or massive testing to just sentinel testing. And maybe some of the experts can talk a little bit about what sentinel testing is. And of course, there is the very highly controversial government policy of restricting mobility of the unvaccinated. So the people who are opposed to it talked about it as a discriminatory policy. The people who are pushing it saying it is for the level of alert level 3, we really have to prevent active transmission. So both are correct. Let's continue that debate and learn from it. Lastly, there are many questions by people who get infected about the new drugs. Molnupiravir, which has been given an EUA in the Philippines and is actually accessible, and Paxlovid. So maybe our speakers will also deal with this specific drugs that are now also available in our armamentarium. But in the end, I think the message to the people watching is, please convince your friends and relatives who are not yet vaccinated to get vaccinated. The vaccine is still working against Omicron and will prevent serious illness, will prevent death. So continue to convince everyone to get vaccinated. If you have been given your second dose October 14 or earlier, you are already qualified to get a booster dose. Do get your booster dose because it's proven that the 3 doses are much better than the 2 doses in fighting Omicron. And lastly, continue to wear masks. And classes have been suspended for next week, so the teachers get a break. The teachers and the student get a break from all this stress of too much restrictions and fear about Omicron. And I welcome that. I think we need to concentrate our resources. I have an increasing number of new COVID cases every day. As of now, I have 63 positive COVID patients in the emergency department of PGH. Technically, it's the de facto biggest COVID ward because each ward, we have 4 wards, each ward just hold 35. So technically, the biggest area with the largest number of COVID is under my supervision. So it's going to get more difficult if the cases continue. 34,021 yesterday, the highest ever number. That's only the number that tested through a PCR test. Many more have tested using the antigen test and have self-isolated using a positive antigen test. So I think the true number of Omicron cases are much higher. The hospitals aren't getting overwhelmed. Why? Because I think majority of the NCR people are vaccinated. So they suffer mild symptoms and they don't have to go to the hospital. They can stay at home, get monitored through telemedicine and all that stuff. So I do hope our speakers will deal with more knowledge. Knowledge is power. And in any pandemic, any disaster, risk communication is still the most important armamentarium to fight the spread of the pandemic. Thank you very much, Susie. Back to you, Raymond and Susie.
Yeah, thank you so much. That's Dr. Ted Herbosa. Ted's always great to hear about the national scene, the policies, the bigger picture, and just sets the tone for us to start looking now into doing the deep dive. But before we do that, I think some of you are waiting for our fun quiz. So Raymond, let's go to our fun quiz.
Thank you and congratulations for being the new DEMS chair. The department that you really started, Dr. Ted. For those who are asking, ito na po ang ating pre-test. There are 2 questions. We have already shared po how you'd be able to access this using Menti. But for the first question here, is also seen on the Zoom poll. Ano ang una mong dapat gawin kapag may nararamdaman ka? The 3 options are as follows: magpa-test, bumukod, o uminom ng gamot. So yun po ang ating 3 choices for our question number 2. And before we move on to question number 2.
Raymond, sandali.
Sige po.
One answer lang ba? One answer lang to? Ito one answer lang, di ba?
Single choice. Yes po. Yes po.
Pero
One answer lang po. Ang question number 1
Yung pangalawang question, pwede
will have more than one.
O sige,
If they could choose more than one correct answer
Ito na
po.
yung mga
Opo.
cute na mga gumagalaw. Sige, go.
Okay, sige. Thank you, Dr. Susie. Before we start with our second question po, no, I'll be greeting those from the Office of the President in Malacanang, and then Senate of the Philippines po, Pasay City, watching us. Ifugao State University Eye Center in Alfonso Lista, Ifugao. Capiz Emmanuel Hospital in Rojas Capiz, the University of Cebu School of Medicine in Mandaue. Sana po okay na po kayo after Typhoon Odette. Eastern Samar State University, Borongan City in Eastern Samar. Hospital ng Kabataan ng Dipolog in Zamboanga del Norte, and Bukidnon Provincial Hospital in Manolo Fortich, Bukidnon. Question number 2. Kailan ba dapat magpa-test for COVID-19? There are multiple choices at least for this one. Option 1, kung ikaw ay may sintomas. Option 2, kung ikaw ay close contact. Option 3, linggo-linggo, weekly. So option 4, kung kailan nyo gusto. So yun po ang mga choices, at least for question number 2. We'd also like to remind everyone that we are being viewed internationally, especially those our friends and colleagues from Osaka University in Japan, Academia Sinica in Taipei, Taiwan, Clinic Kesi Hatan Megatal Kota Kinabalu in Malaysia, Mentari Intercultural School in Jakarta, Indonesia, Bangkok, Thailand, Ho Chi Minh, Vietnam, from Mohammed bin Abdulaziz was Riyadh, Saudi Arabia, Abu Dhabi in the UAE, KBR Diego Garcia LLC in the British Indian Ocean Territory, Flinders University in Adelaide in Australia, University of Waikato, Hamilton, New Zealand, the University of Fiji, Lautoka, St. Catharines in Ontario, Canada, from MGH, Massachusetts General Hospital in Cancer Center in Boston, the ETH Zurich in Switzerland, University of Benghazi in Libya, and International SOS in Angola. Maraming salamat po, especially given the different time zones that you're able to join us for the first webinar of 2022 for our Stop COVID Deaths webinar series. Okay, we will not be closing po ang ating fan quiz as we move on to our webinar proper. So those who will want to join, please continue to key in your answers. Over to you, Dr. Susie.
Thank you very much, Raymond. Maraming sumasagot din sa chat, ha? Hindi nyo mabuksan yung sa Zoom. Sige. Okay lang. Basta nagpa-participate kayo. We want you to engage. We want you to think with us. We want you to ask questions. We want you to learn. All right. So, hindi na tayo magpapatagal. Our special guest for today is someone very familiar to you. We always invite him when we're facing a topic that requires a lot of research, because he researches like he doesn't sleep anymore. It's nighttime where he is. He's in California. We'd like to welcome from the UP Medical Alumni Society in America, infectious disease specialist and internal medicine specialist, Dr. Franco Felizarta. Franco, welcome back to Stop COVID Deaths, and it's great to have you opening the webinar this year.
Thank you, Susie, for the kind introduction. So yeah, this is my fifth time sharing data on the United States. So let me just share my screen.
Okay, it looks good, Franco.
Looks good. Okay.
Yeah.
Okay. So this will just be a update of the Omicron presentation that I did last December. I have about 40 slides, so hopefully we can finish this in less than 20 minutes. Nakalimutan ko ba, magandang hapon po sa inyo lahat. So these are my disclosures. You already know this from before. This one, the Omicron variant timeline was already discussed by Dr. Herbosa, so we can skip this. This is the Omicron geographic distribution. As you can see here, after just 2 months, it spread to more than 150 countries. Okay. This one is the Omicron mutations. And as you can hear, there are more than 50 mutations, and more than 30 are in the spike gene. And at least 25 are unique to Omicron. Now, these are the key variant spike protein mutations. And as you can see here, most of the variants of concern only have 2 to 4 of the most important mutations. Omicron has 7 of the most important mutations. So, for example, the deletion in 6970, 501, and 681, those will help increase transmissibility, and the mutation as 417, mutation 417 and 484 will help with immune escape or decreased neutralization of the virus. So every time we have a new variant of concern, we always ask 4 things. One is transmissibility, disease severity, risk of infection, which includes breakthrough infections, meaning vaccine efficacy and efficacy monoclonal antibodies, and impacts on the diagnostics. So for Omicron, let's start with transmissibility. There's no direct evidence yet for increased transmissibility. But however, if we just analyzing the mutations, there's more than 50 of them, more than 30 in the spike protein. You would know that it most likely it will be as transmissible as Delta, which is actually more transmissible than Alpha. Second is there's a potential for immune escape. So if you have both this increased transmissibility and immune escape, you're going to have a high infection growth rate. So we already knew that Omicron will be trouble because it rapidly spread in South Africa. And not only that, it appears to be outcompeting other variants much faster than previous variants did. So this is the Omicron share of all sequence cases in the United States. So it started with 1% in December 4. After about a month, it became 98% of all cases. From 1% to 98% in less than a month. And in the process, outcompeting Delta, which is Delta was the king. So this is really incredible. Now, this is the worldwide epidemic curves and activity trends. And as you can see, so this one is the worldwide daily new cases. So this one is Alpha, this is Delta, and this is the second Delta major wave, but it was overtaken by Omicron. And look at this, it looks like a straight line. Every major wave probably infected 5 to 15% of the worldwide population, just like influenza. Influenza will infect every year 5 to 15% of the population. But in modeling studies, based on modeling studies, the Omicron wave, this Omicron wave will probably infect 25 to 50% of the worldwide population. Imagine that. So it's the Omicron is behaving like the original ancestral virus with a lot of susceptible population without the benefit of mitigation. This is the overall activity risk. So over time, there's increase in activity and mobility, and there's some correlation. So the more activity or mobility, the more cases you have. So that's the bad news. The good news is for every successive major wave, the peak deaths has been decreasing. Okay, this is during the Omicron wave. Now you have to be careful though, because there's a lag time between cases and deaths. Usually it's about 3 weeks, from cases, hospitalization, then ICU, then deaths. It takes about 3 to 4 weeks. So I expect this to increase, but probably not more than the Delta wave. Okay, so that's the good news. Now let's look at the South African epidemic curves. So as you can see here, there's 4 waves. This one is the original virus with which acquired the D614G mutation. This is Beta, this is Delta, and this is Omicron. Okay, as you can see here, the peak was achieved in less than 4 weeks. So looks like an Omicron wave will last probably 2 to 3 months. Okay, much shorter than Delta. Delta, it lasts about 4 to 6 months. In terms of deaths, so there's explosive cases, but look at the deaths. This is already peaking because there's a lag of, this is already about 3 to 4 weeks from the peak of cases. So this should be peaking by now. So I don't expect this to, to increase further. It should be probably up to here. So as you can see here, for every successive wave, there's increased decoupling of cases and deaths. So cases are increasing, but deaths are decreasing. So that's pretty good news. There's also, as you notice, there's a correlation between the overall activity index and the wave. So if there's a decrease in activity, there's an increase in cases. If there's an increase in activity, there's a if there's a decrease in activity, there's increased cases, and if there's a increased activity, there's an increase in cases. So notice though that during the Omicron wave, there's no corresponding decrease in the overall activity. So it's almost like it's losing fuel. Okay, now remember, this is probably a best case scenario because South Africa, although the vaccination rate is less than 30%, their natural immunity rate is probably more than 50%. Plus, if you assume that they have less severe symptoms because of reinfections or breakthroughs, plus they have a younger population, this will explain the low death rate. This is the United Kingdom with a vaccination rate of about 70%. As you can see, it's already peaked a few days ago. Of course, the cases, other deaths are still increasing, but it should be a lot lower than the previous waves. Of course, the overall index is still increasing, but that's the activity index. Now, this is the United States. Lots of cases, explosive. Actually, it's already more than 1 million cases per day. That's the record. Hospitalizations already broken the record, hospitalizations. But of course, this one will still increase, but I'm hoping this will not be worse than the Delta wave. Of course, the overall activity index is still increasing. Now, remember, vaccination is still very important. This is California with a 65% vaccination rate. This is Ohio with a 55% vaccination rate. And as you can see here, explosion of cases, but low death rate. Ohio, high cases, high number of deaths. It's actually already broke the records for number of deaths. So even if you have a lower severity, if there's so many cases, then the number of deaths becomes more significant. So the vaccination rate is still important. Another problem is the United States reporting the highest levels of hospital shortage, and it's still increasing. What's the reason behind this? Because most of the health, and a significant portion of the healthcare population are being infected. Even if they're vaccinated or even boosted, they're still getting infected. Now, albeit it's milder or less severe, they still have to be isolated. So now this is the Philippines. I'm pretty sure Dr. Wong will discuss this, but as you can see, it looks like a straight line in cases. Hopefully the number of deaths will not increase further. But note that the overall mobility and activity index is not really decreasing. I don't think, worldwide, people are sick and tired of lockdowns. It's been 2 years, so I don't think this overall activity and mobility index will increase. The good news is, if you've seen in Africa, even if there's an increase in activity and mobility, the Omicron only lasted, it will only last probably for a month or two. Now, what's the explanation for this increased transmissibility and immune escape? As you can see here, this is an earlier slide showing that the Delta variant produces higher viral loads compared to other variants. This is Delta, this is Alpha, and this is the wild type. So as you can see here, compared to Alpha, the viral load of Delta is 10 times higher, and compared to wild type, it's 1,000 times higher. Okay, so this is the city value. Remember, city value, lower the value, the higher the viral load, the higher the value, the lower viral load. Usually at between 25 and 30, it's not infections anymore, and below 40, it's undetectable. Now, compared to Delta, Omicron multiplies 70 times more quickly in the human bronchus. This is based on a study from Hong Kong. This is at 24 hours. This is the Delta, and this is Omicron. 70 times more quickly in the human bronchus, but it replicates 10 times more slowly in the lung tissues. This is Delta, this is Omicron. 10 times more slowly in lung tissues. So this is the mouse model showing less lung pathology in Omicron infection compared to Delta. So this is the wild type. As you can see here, there's more consolidation with wild type. And in Delta, you have more consolidation too. But with Omicron, you have less consolidation, and you can just barely see it here for Omicron. So this probably will explain why the severity is less. There's decreased severity compared to Delta or the wild type. Of course, this is a mouse model. We still have to confirm this. Now, how about incubation period, infectious period, and the serial interval? So let's just review this. Remember, the incubation period is the time from exposure to onset of symptoms, and pre-Delta, it's about 5 days. The infectious period is from here to here, which is the time interval during which a host is contagious. And so if for mild to moderate cases, it's about 10 days. For severe, it's up to 20 days. And for immunocompromised, it's more than 20 days. Now, the serial interval is the development of symptoms, okay, with the primary and secondary case. So this is the serial interval from here to here. And pre-Delta is about 4 days. Now, remember, if the incubation period is longer than serial interval, then you can have a pre-symptomatic transmission. This is a pre-symptomatic transmission. So the incubation period is longer than the serial interval. How about the Omicron and Delta? So pre-Delta is 5 days for incubation period, 4 days for serial interval. For Delta, it's much shorter, 4 days and 3 days. And Omicron is even shorter. Incubation period is 3 days. Serial interval is 2 days. Remember, it's 3 days incubation period, but 1 to 2 days before the incubation period, before you have symptoms, you're already infectious. That's why your serial interval will be shorter. Now, remember, it's very hard to prevent infections if you have a disease with a very short incubation period. So, for example, the memory B cell that we have usually takes about 4 to 5 days to be fully activated. That's fast, 4 to 5 days. But the incubation period, Omicron, is 3 days. That's why we're having all this immune escape. The good thing, though, is it's less pathogenic to the lungs. Now, how about infectious disease period? This is a study from Japan, and it shows for patients who are symptomatic, they're still infectious for the day -1 to 9 days. So it's still less than 10 days, okay? Less than 10 days. But if they're asymptomatic, they're only infectious for the first 5 days. So, okay, for the first 5 days. So, so based on this, you can actually decrease the isolation period if they're asymptomatic. Okay, I think with DOH, I think they're gonna decrease. Dr. Anna Ong-Lim will probably discuss this. I think they're going to be decreasing the isolation period, at least for vaccinated patients. Symptoms, really, there's no real difference between Delta and Omicron. It's just because Omicron will infect vaccinated patients and those with previous infection. So you'll have less severe symptoms. So you're going to see more sore throat or scratchy throat, runny nose, and diarrhea. In my experience, though, I've been seeing more patients with rashes. So we already discussed the two. So next is the risk of infection. And there's some preliminary evidence suggesting possible increase of reinfection. This is actually a, we'll discuss this disease severity too. Disease severity first. And this is, it's not yet known, but the clinical outcome data are under review. But there's a study right now that just came out in January 11. This is from California. And they've shown that the Omicron compared to Delta, the hospitalization is 50% less hospitalization. For ICU, it's about 70% less. Okay, and for deaths, it's about 90%. Okay, 90%. Now, remember, this is unadjusted, so you have to be careful. This might go up to 80 or even 70%. And remember, there's a lag between cases and deaths, so this might still increase. So, but this is still good news. In terms of duration of symptomatic hospitalization, it's 3 to 4 days shorter with Omicron compared to Delta. Now, how about age-specific hospitalization? Okay, so this could be a problem because, as you can see here, for patients 0 to 4 years old, they're quite high in terms of hospitalization. This is more than 60 years old. In the United States, the 0 to 4 age group has 5 times the hospitalization rate of 5 to 17 years old. So, of course, this could be because most of the vaccine is not approved yet for 0 to 4 years old. So this could be explained by that. But in South Africa, they've shown that in adults, there's a 29% lower hospitalization risk, but in children under age 18, there's a 20% higher hospitalization risk. So this could be a problem. Now, remember, the absolute number, though, is very low. So even if there's a higher risk of hospitalization, of course, the absolute number will still be low for children. Now, let's go to reinfection now. So this one is a study from England, and it shows that if you are previously infected, you have, compared to patients who did not have any previous infection, you have a 50% protection against hospitalization, 50%. If you were, in terms of infection though, it's 30% protection if you were infected during the first wave. But if you have a recent infection, it's about 60% protection, okay? So this is for natural immunity. Now, this is the vaccine neutralization versus variant. So for Alpha, it's about 2. For Gamma, it's 2. Delta is about 3. and 7.5 for Beta. Beta is the worst. But Omicron is 20-fold, okay? 20-fold higher reduced antibody neutralization. Much worse than Delta or even Beta. So if you look at if you're gonna predict the vaccine efficacy, we already know that for infection, including asymptomatic infection, most of the vaccines will have very low protection. For symptomatic infection, will still be probably less than 50% because this is Beta, this is the vaccine efficacy. And of course, Omicron is worse than Beta. So most of the vaccine protection for symptomatic infection would be less than 50%. But the good thing is for a severe infection, it will still be, you will still have a great protection against hospitalization or deaths, most likely more than 50%. That's the prediction. This is the field studies. So effectiveness against infection, this includes asymptomatic infection. Look at this, it's useless. This is mRNA vaccine, almost useless, okay? But after a booster, it goes up to about, the highest one is for Moderna, and it went to about 60% protection against infection. This includes asymptomatic infection, okay? So even the best one, only 60% the protection. But for symptomatic infection, okay, at least it's not that useless to, two-dose vaccine. It's almost, for Pfizer, it's about 60%. The problem is after 24 weeks or 6 months, it becomes almost 0%. The good thing is if you have a booster, it becomes, at least for Moderna, it's almost 80%. This is for symptomatic infection. The most important is the protection against hospitalization, okay? So this is a study from England. So the protection against hospitalization is only 50% after the first dose. It becomes 70% after the 2 doses, but after 6 months, it goes down to 50% again. But with the booster, it goes up to about 90%. Okay, so it increases the protection rate. Now remember, this is compared to unvaccinated, but unvaccinated Omicron. If you compare it to unvaccinated Delta, it's probably gonna be even higher. Now, this is just a meta-analysis showing that vaccination, protection, effectiveness of vaccination is almost the same as natural immunity. Of course, the safer way of getting immunity is through vaccination. Okay, the chance of dying from a vaccine is almost 1 in a million. Worst case, 1 in 100,000. But for the infection mortality rate of COVID, remember, is 1%, and in an 80-year-old, it's about 10%. And that's not including long COVID. This one is just showing you the predicted effect of a booster dose in neutralizing antibody. This is a busy slide, but the most important to remember here is 3 doses of a vaccine is equivalent to natural infection plus vaccination. So if you have a hybrid immunity, that's pretty good. If you have previous immunity and then you're vaccinated, or if you have vaccinated and you got a mild infection, that's a hybrid immunity. It's equivalent to 3 doses of Moderna. So the last one is the impact on diagnostics. And this is my last slide. And as you can see here, when using the antigen test, there's a lot of false negative in the first 2 days after the first positive PCR test. This is the PCR test. So it's false negative even if the CT value is less than 25. This is the area when it becomes infectious. So even if the CT value is high, there's a lot of false negative with the antigen test. So this is quite concerning. But after 2 days, though, it becomes very accurate, the antigen test. So we really need another study to confirm this. So that should be my last slide. Thank you.
Thank you very much. That's Dr. Franco Felizarta. Brilliant, excellent presentation. I mean, I'm not moving from my seat when you're watching your slides, and I think our audience really appreciates the time that you put into doing all this research and showing us the hard data. So, Franco, I know it's evening in California, but hope you can stay on a little longer for some questions.
No
Raymond,
problem.
over to you.
Thank you, Dr. Franco. Really excellent, no? Kasi we were just talking in the background about the takeaways, especially for the lay folks. Very, very, very insightful presentation, Dr. Felizarta. Thank you for sharing with us things about the science of Omicron, especially the studies done abroad, and we hope we'd be able to connect that with the next presentation to be given by an epidemiologist. He is also the senior technical advisor with EpiMetrics Incorporated. Very, very familiar with all of you already, and he has been assisting since the start of the pandemic, the Department of Health, Dr. John Wong. Dr. John?
Thank you, Raymond. I'll just share my slides. Can you see slides?
Yes, okay. Go ahead, sir.
Okay, thank you. So I'll talk about the Omicron's. Well, I actually call it the holiday surge, no, here in Philippines, no, and I always qualify when it's referred as an Omicron surge, no, because we're not really sure. Okay, so let's start with let's start by calling it a holiday surge and what caused it, no. So several events, no, as we know, it started sometime after Christmas, no, December 26th, no, it started to rise, no. The first week of December, no, SWS conducted a survey and asked people. This was a nationwide survey, no, asked people whether or not they intended to have gatherings with family and friends outside of their bubble, no, outside of their household, and about 46% answered yes, no. So they intended to do that, no, and it looks like from our epidemic curve, it looks like they actually did it, no. We also had imported infections, no, of Omicron, and then of course, no, we know how infectious Omicron is. We've also seen many instances where people supposed to be in isolation and quarantine, no, have gone out, no. And finally, no, we still have not just very low vaccination rates in the country, but very uneven, no, highly concentrated in NCR, no, and much less everywhere else, no. So let's answer the question: is this Omicron? Is the surge Omicron? No? So I'm showing here graphs from Israel, UK, and Germany. No? Let me get my laser pointer. Okay, so Israel, UK, and Germany. You know, so characteristic. So in these countries, we know it's Omicron because they do a lot of sequencing. You know? So what we know that what we observe is that it's a very very vertical sharp spike upwards, no, and much higher than their delta wave, no, in multiples, no, not just a few percentage higher, no, but in multiples, no. So this is Israel, no, very key because they had a period of very low cases, no, because Israel is very highly vaccinated, no, even boosted, no. With UK, it's not so clear, no, because their delta wave didn't really come down that much, no. But then, if you compare to the delta wave, again, it's in multiples, no, of 2 or 3. No? And it looks like they've peaked, no, and are on their way down, no. With Germany, also no clear delineation between their delta wave, no. It didn't really go down, and then they had their Omicron, no. Was on its way down, and then it started going up again, no. So this is interesting to observe in the next few weeks, no, whether this will have a second spike. No? A second observation is that hospitalizations and deaths, no, although also increase, no, do not increase in proportion to the cases. No? So you can see here also, and here. No? So we have this sort of signature, no, of the Omicron wave. No? We don't have a lot of sequencing done in the Philippines. No? We had one run, no? But it was a very small sample, no? Less than 50 specimens, no? And it was done randomly selected. So there isn't much that we can say, no, about the sequencing. No? But from the signature pattern of the waves, no? This is the Philippines. No? This is our Delta wave. No? Rapid increase, no? But not so much, no, for hospitalizations and deaths. No? We also see that if we compute it, no, the doubling time is every 2 days, no, versus the Delta wave increase of doubling every 2 weeks. No? So all of this tells us that this has a high probability, no, of being Omicron, short of having sequencing data. So this is the Philippines, no, compared with South Africa. No? So this is South Africa's Delta wave, no, down for a short while, and then sharp spike, no, with their Omicron wave, and then they're on the way down again. No? Looks like a small uptick. No? The Philippines, no, had a similarly large Delta wave, no, and still going up. No, we haven't seen it going down yet. No? South Africa had the Omicron surge of about a month. No, but we cannot really compare that with the Philippines. No, because South Africa has a very high level of immunity. No? From both natural infections and from antibodies. No? 70% from natural infections and 25%, no, from vaccination. No? So I estimate maybe we have about 10% immunity from infection, and we're about almost 50%. No? So we're about 60% combined immunity. No? So we might not have that short a surge. No? Maybe a few weeks longer. In terms of location, so these are the Delta waves now. I just have to note these are not on the same scale. No? So, for example, these are just in the 1000s. No? These are in the 10,000s. No? So they're Delta waves, and then this is the Omicron surge. No? But it's only in 3 regions: no? NCR, 4A, and 3. No? It hasn't been to the other regions yet. No, this is a good sign. No, because these are also the regions, no, besides Mindanao, that have very low vaccination rates. No, so they're unprotected, no, against any variant. No, so they still have time, no, to raise their vaccination levels. And then, so the theme of this webinar was: is this something we have to worry about? No, so there have been people who have been saying that it's actually a mild infection, no? But studies really show that it is not a mild infection. No, what the research from other countries say is that it's milder than Delta. No, it doesn't say that it's a mild infection. But we know that Delta is more severe than the original strain. So saying that it's milder than Delta is not really saying much, no, about its severity. No? So it's not a mild infection because we see patients still being hospitalized. No? Then vaccinated are still at risk, and long COVID may still result, no, from the infection, no, of Omicron. No? And then I also have to disabuse people of the notion that Omicron can be a natural vaccine. No, it's not a vaccine. No, it's a virus. No, unlike vaccines, the dose of the virus, your viral load cannot be adjusted. If you get too little of the viral load, you don't develop immunity at all, kasi it's swept aside right away, by your antibodies. If you get too high a dose, you get hospitalized. Second, this is an infection. It can cause severe disease. If a vaccine did this, cause severe disease, would have been taken off the market right away. And infected patients can transmit the virus, which vaccines do not do. So in no way is this a vaccine, and should not be thought of as a vaccine. It should not be something desirable that you should go out and get infected with Omicron so that you're protected. It's safer and more effective to get a vaccine. So as we see here, so this is in the Philippines, proportion of severe, moderate, mild, and asymptomatic cases. This is the Delta wave. About as much asymptomatic and mild as a severe critical, maybe a little more. But when it comes to Omicron, we have a lot more mild and asymptomatic cases and a lot less severe and critical. But this small portion here is not zero. It's still about 20% severe and critical cases. So it's not a harmless infection. And Omicron is also a risk to the health system. So this is PGH data. It shows that 11% back in the Delta surge, about than half were admitted for COVID, and the others were admitted for other conditions, but tested positive for COVID. And then this proportion reversed with the holiday surge. Just 11% admitted for COVID. But again, this is not a sign that it's a mild infection, because these patients admitted for other causes and tested positive for COVID may be patients with comorbidities whose conditions were aggravated by COVID. But they're still admitted to the hospital. They still occupy beds. It still take up the time of health workers. And we know that many health workers are presently in isolation and fatigue, and hospital capacity is strained. So even though the risk of hospitalization of Omicron is only 1/3 compared to Delta, it's 4 times more transmissible. So 4 times 0.3 is 1.3. So that means you would expect hospitalizations to still increase by 1/3. So a small fraction multiplied by a large number will still be a large number. So you will still get a large number of hospitalizations, which is what we're experiencing now. This is a new study from South Africa. It shows that in South Africa, at first they thought maybe it's mild because it's a young population, or we have a lot of natural immunity from infections. But after controlling for these confounders, they were able to determine that the primary series vaccination, even without boosters, are still 70 to 80% protective against severe hospitalizations and deaths. And this is against Omicron. They also saw that there is some reduced virulence of the variant, about 25%. So it still means that this is still a dangerous vaccine variant, because the reduction in virulence is not total. So how do we bring it under control? So just the reverse of what caused it. We were able to avoid in translation, unlike last year. There's still, I think, the Feast of Santo Niño and Chinese New Year coming up. Because of the very short incubation period of Omicron, we need faster tests, antigen tests, rather than RT-PCR, and better if they're self-administered or home-based. We need access and affordability of the new oral antivirals, no? So that we can prevent hospitalization, especially among the elderly and those who are high risk, no? And because the isolation facilities can fill up very quickly, you know, because of the high transmission, mild cases can be handled or should be handled at home, you know? And then we need to double down on our vaccination, no? But also recognize what should be the priorities, no? It should be elderly first, the unvaxxed, before giving out boosters, no? And the simple reason is that if you look at the people who are in the hospitals now, they are the unvaccinated, no, not the unboosted. So this is comparing hospitalization, the risk of hospitalization in NCR compared to regions, no, or cases outside NCR, no. Back in the Delta surge, no, it was actually riskier, no, to be in NCR, no. You had a 10% increased risk of hospitalization. No? For this holiday surge, no, your risk is actually less, no, compared to non-NCR regions, no, 60% less, no. And the reason being NCR is now very highly vaccinated, no, 73% from 15% the last time, no, during the Delta surge, no. Whereas outside NCR, no, although they did also increase from 2 to 35, no, they're still very far, no, from even what we call herd immunity, no. So vaccination does protect, no, even against Omicron. So I just show here. I think I presented this a couple of webinars back. No, this is a system model of how to understand the pandemic. No, so these are stocks, no, or people, no. Each box is a certain category of persons, of Filipinos, no. So we can divide the entire population into 4 or 5 boxes, no. There are people who are still susceptible, no, meaning they have not been vaccinated, they have not been infected, no. Eventually, these people get exposed and become cases, no. Most of them will recover. A small proportion will become severe cases, and they will eventually die, no. Right now, we're working towards getting these people vaccinated, no, so that they develop immunity. So over the past 2 years, no, what have we been doing, no? So this is what we're trying to control, no, transmission rate, no, so that the susceptible don't become exposed or infected, no. So there's some things we cannot control, no, with the incubation period of the variant, no. But there are many things we can control, no. So first, we can impose various levels of community quarantine, no, reduce the rate at which people come into contact with each other, and reduce transmission. Second, we can apply the public health measures of testing, contact tracing, isolation, and quarantine, no, and also reduce transmission. No? And then third, no, we can get people to the public, no, to change their behavior, so that they become more adherent, no, to the minimum public health standards, no, and we see how non-adherence, no, over the holidays, no, caused the current surge, no. So these have been effective, no? So for each of the 3 surges we've had before, no, they brought cases back down, no. But they also have unintended consequences, no. So when we raise community quarantine levels, no, it crimps, no, economic growth, no, or slows down economic growth, no. Physical distancing, no, prevents family and friends from seeing each other, prevents children from going to school, no, and affects social and psychological health, no. And then the more we do of this, no, testing, isolation, quarantine, and tracing, the more strain we put, no, on our public health capacity, no. And remember that public health is used for other diseases as well, no, like TB control, no, or HIV. This is the other thing, no, that's happening, no. Severe cases, increase occupancy in hospitals, no? And also strain our hospitals, no? And result in deaths. No? And these are both COVID and non-COVID deaths. No? So both of these or these strategies, no, are not sustainable, no, and create unintended consequences. No? This is an alternative way, no, of battling this pandemic, no, who have a higher risk of being hospitalized. No? So first, you vaccinate, no, continue vaccinating, but you prioritize the elderly. No? Kasi 80% of people in hospitals or people who are hospitalized, no, in the Philippines due to COVID, no, are elderly. No? So to finish or complete the vaccination of the elderly. No? Right now, we're stuck at about 60%. No? We've been about 60-65% for a long time. No? If we can just finish this group, no, A2, no, we can prevent most of the hospitalizations. No? The other thing is to get outpatient antivirals to those who are high risk, no, elderly, high risk persons with comorbidities, no, or A2, A3, no. But in order to treat them, no, we need to make sure that they're positive, no. So we need a rapid test, no. The RT-PCR test, no, will be too slow, no, because there's a very small window, no, to administer this antivirals, no, about 3 to 5 days, no. So next couple of slides to just show you how we're performing, no, in terms of vaccination. No. In terms of supply, no, this was last November. Most of the supply went to NCR, of course, no, and then Luzon. No. Very little went to the rest of the country. No, besides Mindanao, no, received less. No, so that was also the reason for their low coverage or vaccination rates. In terms of vaccination of the elderly, again, we see the same pattern. No, very high for NCR and Luzon, no, but very low, no, for Visayas and Mindanao. No, 70% of regions, no, have elderly vaccination rates below the national average. In terms of who should we be vaccinating first? No? If you have 1 million doses, no? If you give it as the primary series, no? You're able to prevent 10,000 hospitalizations. But if you give it as a booster, you're only able to prevent 2,000 hospitalizations. No? The reason being, people who need boosters or receive boosters already have some high level of vaccination. No? It's less now, no, compared than at the start, no, but it's not nothing, no, compared to people who are unvaccinated. No, they have nothing, no immunity at all. Okay, so it's unvaccinated, no, rather than unboosted, no, that we should be prioritizing. So finally, no, the way to fight this surge is to shift our goal from control of cases, no, to prevention of hospitalization. No? Shift from focusing on the population of susceptibles to high-risk cases. No? So our objective should be to vaccinate the elderly as soon as possible and test and treat high-risk cases, no, within 3 days of symptoms. No? We need increased access to rapid antigen testing, no, preferably self-administered, no, and outpatient antivirals. No? For the low-income population who may not be able to afford these antigen tests, no, make them free, no, at health centers so that they can be tested right away and provided with the antivirals. Yeah, that's my last slide. Thank you.
Thank you very much. That's Dr. John Wong. Again, another excellent presentation, John. And I know our audience appreciates, again, this very detailed presentation, comparisons between the trends in the Philippines and other countries. And let's go to our next presenter. And John, please stay for questions. We have suki na natin to, no? Parang favorite natin na pediatrician, and I should say she's now one of the best communicators on the clinical aspects of COVID in mainstream media. So we'd like to welcome Dr. Anna Ong-Lim. She is the professor and chief of the Division of Infectious and Tropical Diseases in Pediatrics at UP College of Medicine, Philippine General Hospital. Anna, welcome. We know you're very busy, but we always love to have you here, and the audience really appreciates your very easy way of communicating. So go ahead, Anna.
Thank you, Ma'am Susie, and good afternoon to everybody. I feel very honored, to be part of this panel and to join the other very distinguished speakers as we have this discussion about the current issues. And although we hesitate to call it Omicron surge because we want to be very accurate, if we look at the data that has been presented by the previous speakers, it's very hard to conclude otherwise. I think ang hinahanap na lang talaga natin dito is the actual numbers to be shown to us through whole genome sequencing. And this data is being collected as we speak. And perhaps when we look back at this a month or two from now, makikita natin na totoo nga, itong surge na ito was driven primarily by Omicron. So even as we say from the start na ang COVID naman, ano pa yung variant, iisa lang naman ang paraan ng paggagamot, mahalaga din maging aware, that these variants have also been able to take on several different features that need for us to be more agile in terms of crafting a response. So you've already heard the very important aspects of the science that's necessary. And in my short presentation, I'd just like to highlight several interventions that I think require a paradigm shift from us as health workers as well as the general public. So nabanggit kanina that when the WHO released the announcement that .1.1.529 would be called a variant of concern, medyo talagang nakakagulat ito for us in the healthcare professions because alam naman natin kung gaano ka-conservative ang WHO to the point that sometimes nakikriticize nga sila kung bakit medyo may kabagalan ang response. So for them to flag something like this right off the bat na sinasabi ay variant of concern na siya means that there was really a lot of there were a lot of findings that led to this particular announcement. So ano nga ba yung nakita nila? Again, nabanggit na kanina, napakaraming spike protein mutations. And of course, as healthcare professionals and even the general public, we're very much aware that the spike protein is kind of like the key that fits into the lock of our body cells and allows the virus access into its different compartments. So dahil nagbago yung configuration ng spike protein na yun o nung susing yun, ang ikinakaba ng health authorities is that this might lead to an even more efficient method of transmission and a high degree of infectiousness. So specifically, kung titignan natin yung nangyari in terms of the global situation, since the time that the discovery or the detection of Omicron had happened, makikita natin na napakabilis ng pagdami ng mga kaso globally. So if you will look at this particular portion of the graph, you will see that about a month from the time that Omicron was first detected in South Africa, almost 73% weekly change happened from the previous week, reflecting the sudden spike in cases that was being detected globally. hindi ko na ipapakita yung local data, and I'm sure naalala niyo pa naman yung mga nangyari over the Christmas holidays where we had gone down to just hundreds of cases, and suddenly we were hearing that we were again approaching thousands and even tens of thousands of cases being detected. So bakit nga ba ito nangyayari at bakit ba tinawag na VOC kaagad ang Omicron? The two features that stand out really are the substantial growth advantage that it has over Delta, and this was feared at the time to be possibly a reason for its very fast transmission. So nung panahon na natuklasan itong variant na ito sa South Africa, dumami ng husto yung kanilang mga kaso, and this was being used as a basis for sounding the alarm for other countries. However, one reassuring observation that came also from the experience in South Africa was that early data suggested a reduced risk of hospitalization. So again, this continues to be observed. Ayaw nating maging kampante kasi nakikita naman natin, and as was also shared in the opening remarks by Dr. Ted, na napupuno ang mga ER dahil sa dami ng mga pasyenteng naghahanap ng healthcare facilities, no? So makita man natin na mas mababa yung severity in comparison to the other variants, hindi ibig sabihin that mawawala ng impact ang pagdami ng kaso. The risk of hospitalization is only one aspect of severity, and we have seen its effect on healthcare utilization within the country. So let me now go to concrete actions that we can implement now that we have this problem spreading in the country. So alam natin na mas nakakahawa siya. On the other hand, alam natin na versus Delta or the other variants in the past, severity seems to be less, but we cannot call it mild. So dapat ang ating mga responses should be tailored towards these features that we are now observing for this particular VOC. So wala namang ipinagbago dito sa mga mainstream recommendations that are still advocated by public health authorities. Yung mga hindi pa nagpapabakuna, mahalagang humabol na sila sa vaccination. Kasi kung makikita natin base sa mga data, those who are vaccinated with 2 primary doses have had a decrease in protection if in case they were infected with Omicron. And the booster dose restores this protection and improves vaccine effectiveness. So sa Pilipinas, dalawa ang ating pinoproblema. Hindi pa talaga malawak ang coverage ng ating immunization sa maraming rehiyon sa bansa. The NCR is the one that has the best numbers, and we are already aiming for boosting those who have already been vaccinated. But in many parts of the country, coverage can go as low as 10% and averages about 30-40%. And we really need to ramp up these numbers to be able to achieve protection, because if we are seeing the impact of this variant already in NCR where the vaccination rates are acceptable, paano pa kaya pag makarating tong variant na ito sa mga rehiyon at probinsya? Isa pa sa mga tinitignang improvements in intervention are reviewing masking requirements. Tayo'y mapalad dito sa Pilipinas kasi maganda naman ang acceptance natin sa paggamit ng mask. Unlike in other countries, like in the US, where mask use has been quite politicized. No? So sa atin, dito sa Pilipinas at sa maraming bansa sa Asia, we accept that mask use is something that can help limit infections, not just from COVID, but many other respiratory tract infections as well. So kung gawin na talaga natin ang gumamit ng mask, ano pa ba ang pwede nating gawin para mapaigi pa at maging mas mabisa ang intervention na ito? So there are recommendations now to re-examine and optimize mask fit and filtration. So I think it's very important for all of us as individuals and as healthcare workers communicating this information to our constituents that hindi lang sapat sabihin na kailangan magsuot ng mask, kung hindi dapat gamitin ang mask ng tama. Gumamit ng tamang mask at gamitin siya ng tama. So when we say gumamit ng tamang mask, that means the mask has to fit well onto the contours of the face. It should seal the gaps around the face, and it should be used correctly. Dapat nakalapat sa mukha, hindi lang sa kung saan-saang parte ng ating katawan, no? So marami tayong nakikita na naglalakad na the mask does not cover the nose or does not cover the mouth fully, and of course we know that that will not be effective. So dapat ba gumamit tayo ng mas mga high-tech na quality ng mask? Dapat ba tayo gumamit ng mga non-fit tested respirators? Dapat ba tayo gumamit ng double masking? So makikita natin dito ang comparison ng protection that we expect with cloth masks or fabric masks, which could be less than 10% depending on the layers that you use. Surgical masks can provide protection up to 60 or 70%. But if you double your mask, then you can achieve filtrations of higher than 90% because you not only provide extra layers, but the seal is much, much better. So siguro as a practical point, dapat tandaan natin that the surgical mask should be placed under the cloth mask because the purpose of the cloth mask is to seal the openings at the gaps. Now, if you're already using a non-fit tested respirator, so kabilang dito yung mga KF94, KN95, and even if you're wearing a fit-tested N95, nakikita natin na marami ang gumagawa ng double masking with those types of respirators. Ang recommendation actually is to put your second mask, kung gusto mo pa, on top of that fit-tested respirator. Kasi it is already designed to seal against your face. So kung nilagyan pa natin ng layer under the KN or the KF or the N95, masisira yung seal at yung purpose of actually using that particular respirator will be negated, no? Mawawala yung bisang hinahanap natin kasi maapektuhan yung seal na kaya sana niyang ibigay. So wearing a mask that fits tightly to your face can help limit the spread of the virus. And in lab tests, people who face each other with masks can achieve reduction of about 95%. No? And this is something that is very, very important in the context of the very fast spreading virus that we are now dealing with. Let me now focus on another important intervention na maybe we take this for granted already, no? But I think it's worth again, no, reviewing the concepts of isolation and quarantine. No? So ano nga ba ang pinagkaiba ng isolation and quarantine? Isolation means that we want to separate somebody who's already infected to prevent spreading the virus. So this person may be symptomatic, may be asymptomatic, but the common feature for these two groups is that they are actually already infected with COVID-19. So ang purpose ng isolation is really to prevent the spread of the virus. At para maging mabisa ang isolation, kailangan natin matukoy kung kailan ba nakakahawa ang isang tao. So we know that from studies conducted previously that the virus typically is contagious over a 10-day period. Ang nagbago over the current scenario is that more and more people are actually vaccinated. And the question of whether vaccination decreases the duration of infectiousness is something that is constantly being studied. Ito na rin siguro yung dahilan kung bakit tinitingnan natin ngayon ang shortening of isolation for the different categories, the general public and healthcare workers. basically nakita natin na may mga pag-aaral na nagsasabi that vaccination can decrease the duration of infectiousness. And these recommendations are currently being revisited. No? So kaya hindi pa siya inilalabas with finality, meron pang konting pinag-uusapan. Pero siguro let me just emphasize this particular point in the guidelines. Hindi porket pinayagan na tayong lumabas sa publiko dahil tapos na ang ating isolation, ay tanggalan na ng mask at pwede nang kumilos as normal. Sinasabi dito sa guidelines na kung ano pa man yung mapipiling shortening for the fully vaccinated, kailangan pa rin ipagpatuloy ang symptom monitoring up to 14 days at kailangan pa rin ipagpatuloy ang strict guidance or adherence to minimum public health standards, particularly ang paggamit ng mask. So siguro ang practical implication nito sa atin bilang individual. Kung ako ba, for example, as a healthcare worker, ay sinabihan na o pwede ka nang bumalik sa trabaho kasi wala ka namang simptomas at nakita naman natin na ikaw ay vaccinated at boosted. No? So kailangan pa rin, of course, na ako ay nakamask sa aking trabaho, which I will not change because that's standard practice. Pero pagdating ko sa bahay, kailangan nakamask pa rin ako. Kasi nandoon pa rin ako sa panahon na pwede pa akong makapanghawa kung biglang lilitaw ang aking simptomas. So I think this aspect really needs to be constantly emphasized. Maaring dito na lang nakatuon ang ating pansin without looking at this part of the guidance, and I think this has to be communicated well to our colleagues and to the general public. So balikan ko lang ang quarantine. So quarantine aims to try to restrict the activities of somebody who has already been exposed. Ang hinahabol kasi natin dito yung 2 araw bago pa sumumpong yung simptomas. Bago pa kasi magkaroon ng simptomas ang isang magkakasakit, nakakahawa na siya. And if we allow such persons to go about in the community, then they will have inadvertently been infecting others and spreading the virus as well. So we want to make sure that those who are incubating, who are already starting to replicate the virus in their systems, are no longer sharing their infection. So ano naman ngayon ang general recommendations na tinitignan sa atin or tinitignan natin for isolation and quarantine? So nabanggit ko nga kanina, no, that the updated recommendations are really intended to take advantage of the new state of knowledge that we have. So sinasabi natin na maaring yung mga pasyenteng mild lang ang kaso or wala silang simptomas for so long as they're vaccinated will be quite unlikely to be transmitting their virus beyond a certain period. So yung mga bakunado pwedeng mag-take advantage ng mas maiksing duration of isolation and quarantine, whereas those who are unvaccinated will have to follow the previous recommendations. So I think we still need to watch out for an update. So this is still being discussed very closely. As I speak, meron pang maraming discussion on the background. So maybe antayin natin yung final na ilalabas ng Department of Health. Hopefully within today or definitely within the next few days. So finally, ano pa yung kailangan nating baguhin sa ating mindset? Nung nagsimula ang pandemya, ang ating mantra ay test, trace, treat. Ngayon, babaguhin na natin. Dapat isolate, then test/treat. Kasi sa dami ng kaso ngayon, maaring kaya na nating magbigay ng diagnosis base lamang sa clinical presentation ng isang pasyente, pati na rin sa epidemiologic history and sa exposure history. Kung napakarami naman talagang kaso sa community at lahat ng mga kasama sa bahay ay nagpe-present in clusters with respiratory tract illness, mahirap nang sabihin na hindi pa yan COVID. So we're not only revising the testing strategy because of the increased demand, but also because that based on the science that by the time we are able to establish testing for individuals within a household, kumalat na ng husto at wala na rin idadagdag sa ating management yung pagtetest ng isang kaso. So here, we might want to consider that a higher priority should be given for those who are at risk of developing severe disease. So our A2s and A3s should be prioritized for testing. Our A1 should be prioritized for testing. And asymptomatic individuals and those who might have a higher likelihood of mild or asymptomatic disease may be deprioritized. So let me summarize this portion of the presentations for today by just capturing the statement. The Omicron has distinct features that require a paradigm shift for a very effective response. So as I mentioned, hindi na mauuna ang test, dapat mauna ang isolate even before testing. We want to think about considerations for revising isolation and quarantine durations na naaayon sa ating bagong kaalaman. And finally, testing might need to be or needs to be deprioritized currently in favor of immediate management. Maraming salamat po.
Okay, thank you very much. That's Dr. Anna Ong-Lim. Again, as one of our, Anna, they love your presentation. One of our participants said, easy and compassionate communication. Thank you so much, Anna, for that. Okay, so we're going to our panel. I'm going to ask all of our guests to open their videos. And while Raymond is going to make an announcement. Raymond, go ahead.
Thank you, Dr. Susie, and thank you for that last presentation from our resident pediatrician po, Dr. Anna Ong-Lim. Before we go on with our Q&A session, let's just take a very, very quick break lang po for our special public service announcement for today. Take it away, TVUP.
Birthday, mahal!
Thank you, mahal!
Happy birthday,
Happy
Mommy!
birthday,
Hi,
Mommy!
Dad! Hi, Mom!
Thank you, mga anak! Thank you!
Love you, Mommy!
Miss na namin kayo!
I miss you, both of you. I miss you.
Miss ko na kayong lahat.
Mommy, sana magkakasama na tayo muli.
Miss na namin, Mommy. Happy birthday, Mommy.
Miss and love you, Mommy.
What did you wish for, Lola?
My wish? Magpapabakuna na ako.
Ako din.
Dahil mahal ko kayo, magpapabakuna ako.
Thank you so much, TVUP. The COVID communication public service announcement is one of the many outputs of the UP research entitled Communicating COVID-19 in Post-Quarantine Philippines. It's headed by our UP Vice President for Public Affairs, Dr. Elena Pernia, and funded by the DOH and the DOST through the AHEAD HSPR project. Dr. Susie?
Yeah, Raymond, my New Year's resolution is that we'll try to finish all of our webinars at the top of the hour. So I think let's go straight to some of the questions from our audience, Raymond, because I thought the presentations were really very clear, very strong points were made. And so what do you have, Raymond, for our...
I'm picking out the most upvoted, and I think the most upvoted is how to identify if it is Omicron. And I think she is probably just asking, can you really tell if it's Omicron just based on the symptoms or how soon you got sick? Dr. Franco?
Well, in terms of symptomatology, you will not be able to differentiate between Delta and Omicron. Statistically, you will have more milder or less severe symptoms with Omicron, just because a lot more people will have reinfections or breakthrough infections. And then, of course, the unvaccinated population are usually younger too, so they'll have milder symptoms. So statistically, so on a population level, maybe you can differentiate a little bit, but individual level now.
Thank you, Dr. Franco. The next question comes from, hindi ko alam kung katukayo to or it's actually him. The name is Jonas Del Rosario. I don't know if it's the PJ spokesperson, but the question is, for those who got infected by the Omicron variant, is there a need to rush for a booster that's available right now once they are fully recovered, knowing that available vaccines right now are not really Omicron proof? So, and what is the general advice on how soon one has to get a booster after an infection, knowing that reinfection usually is unlikely within 3 months' time?
So this, let's say, so the patient had a vaccination, right? So the scenario is the patient was vaccinated 2 doses.
Yeah.
And then they're supposed to have a booster, but that got infected, right?
Yes, correct.
So what happens is the infection itself was the booster. Okay, of course that's not a safe way of getting a booster, but that's already a booster to the immune system, and that becomes a hybrid immunity. So a hybrid immunity is actually almost equivalent to 3 doses of a vaccine. So so that's one. Number 2 is, after an infection, it's very rare to get a reinfection in the first 3 months with the same variant, right? So yes, you can be infected by another variant, but if you're an ongoing surge and you got infected, it's very, very rare to get a reinfection with the same variant for the first 3 months. Second is, if you get a booster within like 4 weeks of an infection, you might get more side effects, without really increasing the neutralizing antibodies. They actually did studies on this. So if a patient was previously infected and they got a vaccine and they got another vaccine 4 weeks after, there's more side effects, but there's really no increase in neutralizing antibodies. So my recommendation is, yes, the official line is you can get a booster, after 2 weeks, but there's no rush. My preference is at least 4 weeks to decrease the side effects, and you can wait up to 3 months, just because there's the possibility of being reinfected in the first 3 months with the same variant is very small.
Thank you, Dr. Franco. We have a question po, no? And I'll address this to Dr. Ana. It's about COVID home care. And I'll speak in Tagalog para po mas maintindihan ng iba. Meron po ba kayong suggestion sa setup? Kasi ang bahay ko po ay 1 toilet and bathroom po. At as na-suggest po sa akin na self-isolate at home. So, what's the advice that you could give, Dr. Ana, to those that are not living alone pero yun lang po yung kanilang setup po?
That's a really good question, Raymond, kasi I'm sure ganun talaga ang situation ng karamihan sa atin, no? Wala naman siguro may kanya-kanyang kwarto kung 6 kayo, 6 ang kwarto ninyo sa bahay. That's very rare to find. So if we go back to the WHO recommendations regarding isolation and quarantine, they actually recognize it as a problem for many households. And what they've done, or what they've recommended, is if you cannot be separated in individual rooms, you can wear masks and distance. And of course, take care of ventilation. No? So that's a practical approach. Kung meron naman tayong setup na, let's say, at least may 2 kang kwarto, siguro yung lahat ng symptomatic magsama-sama, yung mga asymptomatic pwedeng magsama-sama. Tapos, syempre, mas maganda pa rin yung interactions natin with each other should be masked kasi I'd like just to share a scenario, no, Raymond. For example, yung mga nagko-quarantine, magkasama sila sa isang lugar. Tapos ang nangyari is 2 days forward or 3 days forward, biglang nagkasakit yung isa. I hope people realize na yung count ulit ng mga natira ay back to 0. Baka di nila naiisip yun. No? Kasi bagong exposure na to that person who is part of the quarantine cohort. No? So bibilang ka na naman ng panibagong 14 days. So para maiwasan mo yun, kung babalikan mo yung interactions niyo with each other at mask kayo, kahit pa paano bababa yung tsansa na nag-exposean kayo ulit ng panibago. May tulong din naman.
Okay. Okay. Raymond, we're approaching the top of the hour, and so we're going to answer, Raymond. Let's answer the questions first, and then
Okay.
we're going to do an evaluation. Yeah.
Thank you, Dr. Susie. I'll just answer the questions, but there's one epidemiological question. I'll ask it after this one to Dr. Wong. For the first question, dito po sa ating fun poll, ano ang una mong dapat gawin kapag may nararamdaman ka? 82% ang pumili po na bumukod, but there's still 14% magpa-test and 4% uminom ng gamot. Dr. Ana, what's the correct answer po?
Tuwa naman ako na 79% ang sumagot ng bumukod. Kasi yung talaga hinahanap natin ngayon, no? Siyempre, pwede pa rin naman magpa-test, pwede rin naman uminom ng gamot, pero please, bumukod muna habang ginagawa niyo yung iba pa.
Thank you, Dr. Ana. And then for our second question, kailan po ba dapat magpa-test for COVID-19? Kung ikaw ay may sintomas, 88%. I'm looking at the Zoom poll po, no? And then number 2 is kung ikaw ay close contact, and then weekly, and then kung kailan ko gusto. Dr. Ana?
Ang sagot dito actually is kung may simptomas. No? So this recognizes that kahit ano pang test yan, dapat tamang tao, tamang panahon, at tamang test. No? Kasi kung you use it for the wrong population and in the wrong scenario, kahit gaano pa kaganda yung test na yan, hindi siya magpa-perform. So typically, we want to reserve the test for people who already have symptoms or close contacts of symptomatics. Hindi natin inire-recommend ang mass testing, random testing, asymptomatic screening kasi hindi maganda ang pick-up rate. Pero ngayon, aside from yung sinasabi nating symptomatics or close contacts, gusto rin natin i-prioritize yung mga may matataas na risk na ma-hospital. So sila muna para mabigyan natin sila ng mas maganda pangangalaga.
Ayun. Thank you po. Maraming salamat for that very clear message, Dr. Ana. But before the last messages po coming in from our experts, I have a question po with regards to epidemiology. I'll address it to Dr. Wong. Dr. John, with regards to the total count of COVID cases, very important po na maisama po yung mga antigen test po, no, sir? Especially antigen positive cases. If you have symptoms, not necessarily advised to have RT-PCR. So, do you have any data, sir, with regards to that? And is that something that we should be actively and publicly releasing as data so that we have, a better sense of the entire picture, sir?
Yeah, of course, no, counting cases no, is important. No? But on the other hand, no, control of transmission is also important. No? So by making the antigen test kits available, no, we're able to get people to test and isolate, no, as soon as possible, and for the high-risk people, no, have access to their medication. No? The downside, of course, as you said, no, is if people don't report their positive test, no, or that they tested at all, no, the daily case counts, no, will always be under counts, no. But just the same, I think the benefits, no, outweigh the disadvantages, no. Anyway, from the official counts, no, based on RT-PCR, we can already see trends, no. In very accurate counts up to the last patient, no? It's not that important, no, when you're managing a pandemic, no, kasi sometimes good enough data is good enough.
Okay, thank you so much. Over to you, Dr. Susie.
Yeah, thank you, Raymond. Okay, we're going to give our panelists a minute or two to compose their last message to our audience. And we would like you to give a message to our frontliners because a lot of them are getting sick. So what are your parting words for them? because we're seeing so many of our frontliners get infected and their family members get infected. So we'll give you a minute or two to compose that. Meanwhile, for our audience, we have our evaluation, which Raymond is going to read. Raymond, go over.
Thank you. So while our experts are composing their final messages, we are showing on the screen our evaluation questions, which is going back to its medyo naglolo ko ulit siya. But anyway, we have the 5 questions again here. Sige pa, please apply if you are having any difficulty po, no, just click on the red circle on the upper left hand side. Don't click on the red one. There we go. Don't do that. Okay. And then first question, the panelists demonstrated thorough knowledge of the topic. So it's a 4-point Likert scale. Strongly agree, disagree, and strongly disagree. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And number 5, panelists contributed to new perspectives and knowledge on managing various key COVID-19 health issues. Over to you, Dr. Susie.
Okay, thank you very much. So we're keeping that open, Raymond, right? So people can still continue to do their evaluation. Let's hear our parting words from Anna. Dr. Anna Ong-Lim. Anna, please.
I recognize na marami talaga sa ating mga healthcare workers ngayon ay pagod na pagod, and I'm sure marami ang may sakit. In our department alone, no, we haven't been spared. And kahit inuulit-ulit namin na medyo mas banayad ang sakit na ito sa mga bata, hindi tayo masyadong apektado kumpara dun sa ibang populations ng patients. Having to go through this for over 24 months has taken its toll. And pati na nga ngayon na tayong mga healthcare personnel ay apektado, ang mga pamilya natin apektado, mahirap talagang sabihin na laban lang. Pero I'm sure you understand that we have a very important and essential role to play. And I think yung sense ng helplessness, yung anxiety, can always or can be countered by the knowledge that we're gaining on a daily basis about how best to address this problem. Marami pa tayong pwedeng gawin, marami pa tayong pwedeng itulong sa ating sarili, sa mga pamilya natin, at pati na rin sa ating mga pasyente. So if we're able to put all of this knowledge together and apply it, I'm sure magkakaroon din tayo ng magandang progress habang binubuno natin itong problema. Thank you.
Okay, thank you very much. It's Dr. Anna Ong of the Philippine General Hospital. Let's go to sino bang before? Dr. John Wong. John, go ahead.
Thank you, Susie. Very difficult 20 months, no? And I can possibly understand, no, the facts you've been going, and I think with a lot of other, you know, we for your service, you know. Probably what I can say is, if we follow the other countries, no, this should be a little longer than for South, no, pero really not as long as the Delta surge, no, because of the way the rapidity, no, of which the. Thank you.
Okay, thank you, John. And then, Franco, our last message from Franco. I think Ted has left. Is Ted around? Okay, so Franco first. Go ahead.
Yeah, so remember, Omicron is, you know, highly transmissible, and, you know, it has immune escape. So it's really very hard to prevent infection. So that really the priority is to prevent severe disease. And so if you are elderly, or you have comorbidity, it's very important to have a booster. And of course, if you're not vaccinated, you know, you need to be vaccinated. And to prevent transmission to the, you know, vulnerable people, you know, recommendation is at least indoors. You need a double mask. You need a double mask, or preferably an N95. The good, at least the good news here, so I agree with Dr. Wong, that it will be fast. Delta usually lasts 4 to 6 months. Omicron should last only for 1 to 2 months. So at least hopefully by March we will be okay. So I mean lahat pagod na eh. It's been 2 years. Physically, mentally, it's really exhausting. And then sometimes even if you're infected or if you're exposed, they still want you to work. At least in the United States, if in a crisis in the United States, if you're infected but you're boosted and you're asymptomatic, you have to go back to work. There's no you don't even quarantine or you don't even isolate. So because you want you to go back to work. So so it's really physically exhausting. But the good news is hopefully this will be over before March. Thank you.
Okay, thank you very much, Dr. Franco Felizarta, and to all our speakers who joined us today. Maraming salamat. You can see in the chat how our audience appreciates every part of your presentation, and we are hopeful that this helps us all feel a little better about what we're facing. As you all said, pagod na nga lahat, pero sana, hari nawa, di ba? We pray that it will be a short, intense run this time. So we have our closing remarks from the Assistant Director of the Philippine General Hospital, Dr. Stella Marie Legaspi. Go ahead, Stella. Jose. Sorry.
That's my married name.
Sorry.
It's all right. To recap our webinar for today, Dr. Franco Felizarta spoke on the increased transmissibility and the immune escape of the Omicron variant. He said the more mobile you are, the more we increase the transmissibility. Ibig sabihin, yung labas ng labas at kung saan nakakarating, yan ang nakaka-increase ng transmission natin. For every successive wave, he said, the number of deaths is decreasing. So that's his observation in the US. And he also predicted that the Omicron wave will last for 2 to 3 months, while the Delta wave lasted for 6 months. He emphasized the importance of vaccination. He said that the vaccination decreases, the number of deaths decreases for the vaccinated persons. And Omicron is 70 times more transmissible in the upper airway, but it replicates 10 times slower in the lungs. Okay, so that's also good for us. So good for the patient. And he mentioned about the incubation period, comparing the Omicron virus of 3 days. The Delta had 4 days at the incubation period. So it means that the patients really get the virus earlier, in the Omicron variant. And when a patient gets infected, so the patient gets the natural immunity, and it is it improves the neutralizing it increases the neutralizing antibodies, and it is like with immunization, it's like you get 3 doses of the vaccine. Now, Dr. John Wong, I also appreciated his lecture. He noticed that the cases are higher, but the deaths and the hospitalizations are lower. And for the Omicron, he said the doubling time of 2 days versus the 2 weeks of the Delta. But he emphasizes that it is not a mild infection. So tanggalin natin sa isip natin na mild lang yan. Okay? Because patients are still being hospitalized, and the unvaccinated are at increased risk. Okay? So, diyan pwedeng magkaroon ng long COVID. So, yung long COVID, merong symptoms of COVID even if naka-recover na from COVID. Okay? So, that is a very frightful thing to happen. It is a virus, not a vaccine. So, in other webinars, you can hear that the Omicron virus is a vaccine. No, it is a virus. And the dose cannot be adjusted like a vaccine, and it can cause severe disease, and the infection can be transmitted to others. So, but he said also that the Omicron is 25% has 25% reduced transmissibility, virulence compared to the Delta variant. So, ang gusto ko sa kanya yung kanyang parting words. Number one, avoid super spreader events. So, yung translasyon, so, hindi siya nangyari, no? So, talaga ng super spreader event natin. I'm a strong Catholic, pero still, the translasyon scares me. So, he said, make antigen tests more available. Like in other countries, in Singapore, you can buy it in 7-Eleven. And number three, yung mga anti-COVID pills, molnupiravir is one, and Paxlovid. So, there are already oral meds for mild to moderate cases. Vaccine we should vaccinate the elderly first, followed by the unvaccinated, and followed by the giving of the booster doses. And we have to emphasize home care for the mild. He said we should shift our focus to vaccinate the elderly and to do outpatient treatment for the high-risk cases so that we will reduce hospitalization and reduce the number of deaths. So for low-income population, sabi ni Dr. John, the rapid antigen, make it more accessible, and kung pwede lang, make it free for them. Yan yung I think yan yung sinasabi nating social equity. Okay, so for Dr. Anna Ong-Lim, a very wonderful lecture by Dr. Anna. She said, get vaccinated, physical distancing, at saka yung mask fitting and filtrations should be optimized. And sinabi rin niya yung double mask. So kung yari, magdo-double mask kayo, the surgical mask, and then on top of it is the fabric mask. And she emphasized yung difference ng isolation and quarantine. And yung sinasabi niya to deprioritize testing. So Omicron has distinct features that necessitates a paradigm shift. So ang importante talaga, immediate isolation. And susunod na lang yung testing if necessary. Thank you very much, Susie.
Thank you very much. That's Dr. Stella Marie Legaspi Jose. Papatayin ako ni Ato for not giving your name. Thank you for that excellent summary. And Stella is the Deputy Director for the Philippine General Hospital. We're always grateful for all the support of PGH for this webinar series. Next week, okay, nako. Nice topic, okay? Dapat bang bakunahan ng mga bata? Safe ba ang bakuna para sa mga bata? We will talk about the pediatric vaccines. And so please join us. Invite all the people who are interested in this to join us on the webinar. We take 3,000 on Zoom, but you can also join on Facebook. So Raymond, over to you.
Thank you so much, Dr. Susie. We are still seeing the evaluation poll taking a life of its own. So sana po ay ma-end na po natin siya. Okay. Thank you again to all of our panel of experts. And this is really a good jumping off point po as our initial offering of a webinar po for the year 2022. We will also like to acknowledge, before we conclude the program, our very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, we will not be able to come up with quality content for our credible online community. And finally, all Stop COVID Deaths webinars are archived for viewing at the TVUP YouTube channel. So you just go to youtube.com and then go to the TVUP channel po, and all of our 82 and soon will be 83 webinars, you'll see that recording. I for sure, and Dr. Susie will also be doing another replay in the playback po of our webinar for today. So that formally closes our webinar for this week. Next week po, very, very important, especially for those who have children, ang ating topic for next week, and we hopefully are able to come up again with exciting and interesting insights from the webinar for next week. So we look forward again to your company next week. Let's see each other every Friday from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer. I am here, you're not alone. I'll stay with you until the coast is clear. The other's pain before my fears, the other's lives before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Just look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The other's pain before my fears, the other's vows before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The other's pain before my fears, the other's lives before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The other's pain before my fears, I'm pushing on despite the tears. Please take us through another day. Just hold my hand, and I will hold the line. I will hold the line.